Hello everyone, I am Dr. Vishnu Soni from Udbhava Hospital, Miyapur. I am consultant general surgeon here. Today we have gathered here to discuss a topic on renal stones, also called as kidney stones, also called as renal calculi. So, to the convenience of the audience, I would speak in English and Telugu as well, so that it would benefit the local audience here. Right. So, as we said, today's topic is renal stone. Renal stones are nothing but an solid mass in the kidney which is formed with grouping or combination of crystals. Small crystals combine or join to form a stone in kidney. And why does stone form? Because of supersaturation of urine in the kidney, which will lead to form stone. So, going in detail for the renal stone, I would also like to discuss today how do you diagnose renal stone and what are the different modalities of the treatment. So, as kidney stones are very common, kindly listen to this and do share with everyone. Right. So, renal stones, going into the topic, basically what are the types of renal stones? So, there are various types, but majorly there are 5 types of renal stones depending on the composition of renal stone. So, various types are calcium stones, triple phosphate stones, uric acid stones, cystine stones. These are 4 major types. There are also other types. So, the most common type of stone which we see generally is calcium oxalate stones. Again, calcium oxalate stones are of 2 types: calcium oxalate monohydrate, calcium oxalate dihydrate. So, calcium stones are the most common stones, and these are the strong stones. These are hard stones and they are found in acidic urine. Next, coming down to different types such as uric acid, cystine and triple phosphate stones. These stones are identified by their shapes. There are various shapes. These are studied under microscope, and based on the shape and the composition of the stones, they are categorized into various types. Coming down to clinical features, the important part here is patients come with symptoms. So, based on the symptoms, you recognize whether it is renal stone or some other pathology. Right. So, most common symptom is pain. Yeah, pain. Where does the pain occur? Pain occurs in the lower back or in the lower abdomen. These are the places where your renal stone pain can occur. Why does the pain occur in the lower back? Because the location of the kidney. The stone, based on the location of the stone in the kidney as such is kidney, ureter and bladder. So, this is a system: kidney, ureter and bladder. So, based on the location of where the stone is, you will have different types of pain. So, if the stone is in the kidney, you will have pain in the lower back region, you will have pain. If the stone is in the ureter, you will have pain in the tip of the scrotum. If you have stone in the opening, ureter opening just into the bladder, if you have stone there, then the pain will be at the tip of the penis. So, based on the location of the stone, you will have pain. So, pain is one most common symptom which is typically present from loin to groin. That means back to the groin, it will radiate. That's a major kind of or a major symptom the patient presents with, that is pain. Other symptoms can be hematuria. Hematuria is nothing but blood in urine. Third thing is hydronephrosis. Nothing but due to the stone, the passage of urine gets blocked and the kidney gets filled. That is called as hydronephrosis. And sometimes you can also have infection because due to stagnant or due to not passage of urine stays in the kidney and this will lead to the formation of infection. So, patient can also present with UTI, that is urinary tract infection. These are the various kinds of presentations of renal stones. Then coming down, how do you diagnose it? How do you diagnose it? It is mostly or most of the times kidney stones are diagnosed by ultrasound scan. Ultrasound abdomen is done and most of the time kidney stones are scanned. But gold standard or for 100% accuracy, we need to do non-contrast CT scan of the abdomen, which will lead to diagnosis of kidney stone. These are the two major diagnostic modalities. Other modalities can be X-ray, because 80% of the times, 90% of the times renal stones can be seen on X-ray. 10% of the stones cannot be seen, but 90% of the times they are radiopaque. That means X-ray can catch renal stones. So X-ray can be done, X-ray KUB or X-ray abdomen can be done to diagnose renal stones. Other modalities are IVP or direct cystoscopy. These are the different modalities, but gold standard, that means 100% accurate, that is CT scan, non-contrast, plain CT scan of abdomen or CT KUB will give you 100% diagnosis of renal stone. These are the different modalities of to diagnose renal stones. Then coming down to treatment. See, most of the times if the stone is less than 5 mm, patient will be asymptomatic, or else if the patient is having symptoms, they will be treated by conservative, that is by oral medications. You can give antispasmodics, you can give painkillers, basic painkillers like paracetamol, and this will work and pain will be subsided if the stone is less than 5 mm. And if you give proper hydration, that is more of liquid diet and more of water and liquids, then it will stone will come down on its own. So less than 5 mm size stones, no treatment is required, no treatment to be given for less than 5 mm stone. If at all if the stone is more than 5 mm and is causing severe symptoms, then the treatment is first treatment is ESWL, extracorporeal shock wave lithotripsy. This is an based on shock blast wave dynamics, that is waves are passed and stones are blasted. That means stone will blast into small pieces and this will come down through urine. So non-invasive basic treatment is ESWL, and if it is contraindicated, then other modes are PCNL and RIRS. PCNL is percutaneous nephrolithostomy. We pass a stent through skin near to the stone into the kidney. We make a hole in the kidney and by then we extract stone. That is PCNL. Other mode is RIRS. RIRS is the latest method in which lasers are used to remove the stone. So these are the three different modalities of treatment for renal stone. That is, first one is ESWL, that is blast wave dynamics. This is a non-invasive procedure. Patient is made to lie down on a flat patient is made to lay down on a flat board, and then from below there blast wave dynamics are given. That means waves are sent so that stone is blasted. So this is ESWL, then PCNL and RIRS. These are different modalities of treatment. So this is all about renal stones. Thank you.